Okay, in this video we will begin by performing the assessment of the head and the neck. The equipment we will need for this assessment is a tape measure, such as this one, or any other one that you may have, a stethoscope, a cup of water, and a transilluminator. So we'll start with the assessment of the head and the neck. We will start by just inspecting the head. There are 6 different characteristics that we will be assessing. The first is just the head position. So while we were talking to the patient and getting a history on them, we just need to look and see how they hold their head, and if they're holding it upright, and if it's still or if it's moving. Now, if the head seems to be tilting to one side, that may be indicative of maybe a unilateral hearing or vision loss, or maybe the muscle, the sternocleidomastoid muscle there is maybe have shortened a little bit, which they call torticollis. Another thing that you may want to look for is the possibility of maybe a jerking motion that they're doing as you're speaking to them. This jerking may be indicative of a tremor, of some underlying disease. Or maybe if you see them doing like a nodding motion, that could very well be due to aortic insufficiency, especially when the pulse is synchronized with that nodding motion. So furthermore, another thing we need to look for when assessing the head are facial features. We need to take a look at the shape of the face and also the symmetry. We want to note that both sides are symmetrical. There may be slight asymmetry that you may note in some cases, and that's not unusual to note. Now, you need to see and pay attention to these facial features and symmetry when the patient is at rest, and also when they are moving and when they are making certain expressions. You need to see how these changes contribute to their symmetry, if at all. Now, you need to note that when looking at these facial features, a person's race, a gender, and body build may very well influence the type of facial features they have. So you may want to be knowledgeable in that sense, in those cases where you may have people of different genders, races, or body build. Another thing we need to look for is possible tics. Now, what are tics? Tics are normally spasmodic muscle contractions that you may have anywhere in the head, neck, or face. And sometimes these tics arise due to a possible facial nerve degeneration, or maybe pressure that's being placed on that nerve, or maybe from something called a Tourette syndrome, or it may just be psychogenic in origin. So those types of things would need further assessment as well. Now, looking forward at the shape and possible unusual features that you may see on the face. Now, these sort of things, more often than not, may indicate a certain disorder or syndrome, but these things develop very, very slowly. Sometimes physicians will ask a patient to show them a picture of them from years ago so that they can compare it to how they look now in certain cases such as acromegaly. But you want to take a look at possible edema, prominent eyes, such as hyperthyroidism, hirsutism, bruising, coarsened features, a possible lack of expression. If you note that there's unusual perspiration, pallor, pigmentation, all of these things are differences that you need to take note of, because all of these different characteristics may very well be put together and be features of some sort of disorder or syndrome, as there are very many. looking forward, now we're going to be inspecting the skull. The skull also needs to be checked for its size, its shape, and its symmetry. Now, if you see that the entire face is affected, normally that is due to facial nerve paralysis as opposed to a facial nerve weakness, where you would only see the lower face that is affected. Now, if you see that the mouth has some sort of issue or problem, you're looking at a possible problem with the peripheral trigeminal nerve. So it is very important if you see differences or abnormalities in certain areas to check exactly where those abnormalities are located, as they can tell you what the underlying problem may be. Now, the scalp is another portion that needs to be looked at, and I'll go ahead and ask this patient to go ahead and turn my way. And the way that we check the head, or the scalp, I'm sorry, is that we end up parting the hair from the frontal to the occipital region. We pay close attention to the area behind the ears, in the hairline, and the crown of the head. Now, when we do this, we want to part the hair just like this, going from the frontal all the way to the occipital region. And what we're doing is we're checking for any lesions, we're checking for any tenderness, parasites, any nits, scaliness, or a possible hair loss pattern. Now, if you note here in this patient, I'm going to go ahead and turn his head your way. This is something that is very, very common in men, and you'll see a bitemporal recession of hair or balding over the crown. This is something that's common, and it's not abnormal. And sometimes you will also see this type of loss of hair in women as well, and especially those that wear their braids very, very tightly. Sometimes even you might see hair loss in children. And in children, normally this is due to an infection of the scalp due to some type of fungus, and we call that typical disorder Tinea capitis. So very, very important to check that as well. Now let's move forward to the palpation of the head. Now there are 5 different areas that we need to pay attention to. Now, whenever we palpate the head, we want to make sure we do a rotary movement when we do so. So we'll start off with the skull, and again we're going to go from the front to the back, and we're making sure that it is symmetrical and smooth when we're assessing it. Now, when we do this, I'm going to go ahead and do a rotator motion such as this, going all the way to the back. Now, the scalp should move freely, okay, which it does, and there should be no tenderness, swelling, or depressions when I go from the front back. The reason for this being is that by the age of 6 months, the 7 cranial bones should have fused by now, but don't be alarmed if you feel that the ridge of the sagittal structure is still felt. Some individuals still have that, okay, that ridge. So next thing we know when checking the head is the hair. Now the hair can tell you a lot. Normally the hair is smooth, symmetrical, or symmetrically distributed, and should not have any split ends. So as you know here, it's pretty much as it states there. Now if the hair is not so, and you have it looking coarse and dry and brittle, this very well may be indicative of hypothyroidism, as opposed to fine and silky hair that may be indicative of hyperthyroidism. However, this could also be a familial trait. Now, going on to the next area of palpation would be the temporal arteries. Now, the temporal arteries are more something that is important to assess in older individuals, as they're the ones that are more commonly affected by a disorder called temporal arteritis. Now, when you palpate the temporal area, you're checking for thickening, hardness, or tenderness of those temporal arteries. And in some cases, in older adults, you do find that. Now, we're going to go ahead and stop with this video here. We'll continue with the next one. So tune in for the next video.